This is Diamond D with where I'm giving you some love advice, some happiness advice, some everyday good advice to make your day a little more loving.
Hi, this is Diamond D with Love and Happiness, where I'm giving you some love advice, some happiness advice, some everyday good advice to make your day a little more loving. Our guest today is Dr. Anika Goodwin. She is an eye surgeon and specialist that is the CEO and co-founder of Eye Emergency MD, a telemedicine eye practice, and the founder of Opulence MD Beauty, which is a beauty brand eyelash company. She received her medical degree with the University of South Carolina in Charleston and completed her medical residency at the State University of New York. She currently practices and specializes in reconstructive and cosmetic surgery of the eyelids, brows, orbits, and other issues. Thank you, Dr. Anika, for being on the show today. So I hope you're doing well today.
I am doing very well. Been looking forward to this all week.
Good. I have been looking forward to having you on as well because I know you have some valuable and some good information to share.
I hope so. I hope that you guys are interested. I have been told eyes can be a little bit boring, so I hope we can make it very interesting for you tonight.
Oh, yeah, absolutely. Absolutely. Dr. Nika, I think it was maybe it was Matthew in the Bible that said something about the eye being the lamp to the body. And if your eyes are healthy, then your body is healthy. But if your eyes are not, if there's some darkness in it, then your body somehow is tainted. Can we talk a little bit about how eyes can reveal certain things about an individual's health?
That is absolutely true on both a physical level as well as a psychological level. So let's deal with the physical first. I love what I do. I love being an ophthalmologist because so many times we look into someone's eyes and get a hint of other things that are going on that have not even been diagnosed before. We have the privilege and sometimes the burden of seeing people and seeing certain findings in their eyes that let us know that they may have cancer going on inside of their body, that they may be a diabetic and not know it, that their blood pressures may be out of control. There's so many things that we can tell simply by looking into someone's eyes. And it was one of the things that originally appealed to me and made me want to become an eye doctor. It is so exhilarating to look into someone's eye. You're actually seeing a part of the nervous system. No other specialty can say that they're able to see a part of the brain system simply by looking into an organ. But as far as the psychology of it is concerned, people who are being less than truthful, people who mean you harm, a lot of times you can look into their eyes and see their intentions. Have you ever heard someone say someone has mean eyes or sad eyes? Even without a facial expression accompanying it, you can look into someone's eyes and really see what they're feeling, if they're being truthful and forthright, and whether or not this person may be up to no good. So the eyes are a window to your soul in so many ways.
Oh, absolutely, absolutely. So, I was always curious because I know sometimes when you go to the doctor, just for like, just a general checkup, just to make sure you're all right. The doctor always checks your eyes and your ears, and I was always wonder why they would shine that light so brightly in my eyes. But now I have clarity on how the eyes can impact different situations and different health causes, which is good.
Yes, yes. So the eyes, because the pupil is a dynamic structure. So if you look into someone's eyes when the light is very bright, let's say you're outside, then your pupil is going to be really small. If you look into someone's eyes when you're in dimmer light, the pupil is going to be large. Because the pupil has the capacity to change its aperture or its diameter, it can become small or it can become big, then we have to be a little bit subtle in the ways that we diagnose the eye. So we use a lot of lights and a lot of mirror type systems in order to trick the pupil to be able to see into the eye and see what's going on with someone's health and with their vision.
And I think there were some health concerns that cause blindness. How are you able to diagnose that? And can you talk a little bit about some issues and some health-related matters that can lead to loss of sight?
Mm-hmm. So There are the top five, or let's go with the top four. The top four causes of blindness worldwide right now is number one, cataracts. That is not number one in the United States, but worldwide it is. Because we're in a developed country with a reasonably good medical system, people rarely go blind because of cataracts, because there's a surgery that we can do to remove your cataracts and allow your vision to be restored. But in countries that don't have access to good medical care, your cataracts can grow to a point where they can rob you of your sight, and they don't have access to the surgery to be able to cure this. So cataracts is number one. Number two is diabetes. And I don't know if that surprises you or not, because I was doing an interview earlier this week and someone made the statement, I didn't know diabetes affected your eyes. Diabetes can affect every single organ in your body, and the eyes are just one of those. But because diabetes is one of those things that either if you don't see a doctor, you may not have been diagnosed, so you may not know you have it, or if you know you have it, you may not be doing all the things you need to do to keep it under control. You may not be eating right. You may not be taking your medication the way that is prescribed. And so diabetes that is not adequately controlled can result in bleeding in the back of the eye. Over time, that bleeding can create scarring in the back of the eye, and that can cause pulling or detachment of the retina. And the retina is basically like film in a camera. So if you imagine back in the day when we didn't have digital cameras and cameras had film, if you were to rip that film or pull on that film, your pictures wouldn't come out. That's exactly how the retina works in the eye. And diabetes manifests there and causes bleeding and tearing, and then will leave you with loss of sight. So that's number two, diabetes. Number three is macular degeneration. You don't see it in African Americans very much, but that doesn't mean that we're immune to it. We're not also subject to having macular degeneration. And what that is basically a breakdown of a portion of the retina that's responsible for our very best vision. And once that starts, that process is not reversible. Macular degeneration is genetic, and so it's passed down. And because it's more common in Caucasians, but there have been some mixing of races and genes, that is why we're not totally immune to it. And it can also affect people of color. And the last one, number four, is glaucoma. And glaucoma disproportionately affects people of color. So that is something that we all need to be very aware of. Glaucoma is known as high pressure in the eyes. And what basically happens, just like high blood pressure in your body, high pressures in the eyes can start to cause loss of vision by creating damage to the nerve that supplies the eye. I like to think of it as the cable to your TV. When you have cable and the cable is going from the wall into your television, you have a great picture, right? You can watch anything you want. But what happens if you cut that cable? The picture goes bye-bye. Same thing that happens with the nerve in the back of the eye. If glaucoma causes so much damage to that nerve that that nerve can no longer function, it's like someone pulled the plug and your vision will be lost.
That's fascinating. Very fascinating. So that was number four. What's the fifth one you said? Or did you have to?
Just four. The fifth one is it's trachoma. It's not something that we see very often. It's basically like an infection. It is a parasitic infection. You see it in countries that are less developed, and it can be, you get it from water that's infected with the bacteria. So we don't see it very much. That's why I didn't mention it.
Okay, that is good information. I had heard that there's some blindness and some eye injuries and eye infections that are caused by STDs. And if a mom is pregnant and has an STD and delivers a baby, they can, or I guess they used to, or they're able to, transfer that STD to their child and cause an eye infection. Is that true, or have you heard of anything like that?
Absolutely. It's very true. And it's a great topic to consider right now, because with coronavirus around, some people don't realize that it's not just touching your mouth. If your hands touch an infected thing or something that has the virus on it, if you touch your eyes as well as your nose and your mouth, you can contract the virus that way. And that's because the eyes, the nose, the mouth, and the genitals all have something called mucous membranes. Mucous membranes are that soft kind of wet tissue like you feel in your mouth and your nose. And that tissue is particularly susceptible to infection, whether it be from a virus or from a bacteria. And so sexually transmitted diseases happen because those mucous membranes are so subject to infection with things like gonorrhea, things like chlamydia, things like syphilis, which we don't see as often, and even things like herpes. So those are the most common STDs that we see that not only affect the genitals, which is where we most commonly think of STDs manifesting, but they also can affect the eyes, and to an extent where you can have permanent loss of vision.
And it affects the baby. I assume that nowadays, doctors have some type of antibiotics or medicine that they give the babies at childbirth so that it doesn't pass. But if that's not conducted, I mean, you think about something as serious as chlamydia, chlamydia in a mom being able to be transferred to a baby and cause that baby to go blind. I mean, that is heard of, but it's true. It doesn't.
Babies are coming right through the birth canal, and the birth canal is a mucous membrane, one tunnel of mucous membrane. And so when babies come out, as they pass through, if the mother has infection such as gonorrhea, such as chlamydia, then the baby in coming through that infected passageway can pick up that bacteria, particularly in the eyes. And so what we have done for many years is, and you probably, if you've had a baby, you remember this, we put a certain antibiotic ointment in the baby's eyes to try to prevent, or we call prophylax. Prophylax means prevent, to try to prevent the baby from getting that disease should the mother have it. But we've also gotten more savvy. So now we test mothers to see if they have these diseases. And if they do, then we treat the mother with antibiotics. But oftentimes we will still put ointment in the baby's eyes just to be sure, because the visual consequences of these type of infections when the baby gets it from the mother through the birth canal can be devastating visually.
Oh, wow. That is fascinating. Fascinating. Do you talk about any of these issues in your eye emergency book?
I don't talk about birth canal related things because normally those things are picked up in the hospital. So we usually pick those things up before the mom ever takes the babies home. And so that's not something that you will typically see out and just at your home. So my book is meant to help people with things that are commonly seen just at home, when people say my eye's a little bit red, or I have a sty on my eye. Common things like that. This helps you determine if that's indeed what's going on. It helps you compare your symptoms to the symptoms that are normally seen with that. It has pictures that help to guide you, and it lets you know, how serious is this? Is this something that I need to be in the emergency room for? Is this something that I can wait to see my eye doctor next week? Is this something that may threaten my vision immediately? And those things are really important right now, because the emergency room is the last place you want to be unless you really need to be there with this pandemic going on. So it's nice to know if this is something that I need to have care for right away, or if this is something that I can do something for at home and then have care either through telemedicine or through my doctor's office that has a lower possible transmission rate for the coronavirus.
Yes, that's good information. Good information, Dr. Anika. So what brought you into this area of medicine? Did you always, like as a child, were you always fascinated with the eye?
No. It's a wild story. I have wanted to be a doctor as long as I could remember. I think that's the only thing I've ever told people. I don't know how I knew. It's not like I had any doctors in my family, but I knew I wanted to be a doctor. Now, if you had asked me what kind, I would not have known, but I just knew I wanted to do that. So when I got to medical school, I had quite a task in front of me, just trying to figure out what kind of medicine do I want to practice. There's so many specialties out there. And so for me, it became a process of elimination, learning myself, trying different things, taking care of different types of patients, and finding where I found joy. And it wasn't ophthalmology, because ophthalmology is not a rotation that you normally do in medical school. So I got introduced to ophthalmology accidentally. I'd chosen a totally different specialty. I'd chosen OBGYN. So I would have been working below the belt. I would have been working below the belt. But because I interviewed at programs that I really liked early in the process, I had more interviews scheduled, but I canceled many of them. So I had some time to take an extra rotation. So I was trying to figure out what might help me in practice. We don't learn a lot about eyes just in general in medical school. So I decided I'm going to do ophthalmology. I can learn a little bit about eyes, might help me later on, is what I'm thinking. I remember going to that rotation the first week and coming home and telling my spouse, that is what I want to do for the rest of my life. It is the most amazing thing I've ever done. And if I don't do that, then I can't imagine being fully satisfied in medicine. And so I knew just from that first moment that that was what I was meant to do. So it just goes to show you, we make plans and God laughs because he knows what he has in store for us.
And you're doing so much more. You're doing so much more with the eye. You're sort of expanding into eyelashes. Tell me how you got involved with that.
I'm just a glamour girl. Honestly, I've always I've always been. My mom used to tell me, I'll never forget this. She would tell me, Anika, you are so gaudy, because I was the person, I wanted the brightest lipstick and I wanted the biggest purse and all these things. So I've always just been a person who loved beautiful things and dress up and all those kinds of things. So one of the things that I found as I became busier with training and with family, having children, is that I didn't have time to really kind of put myself together the way I normally would like to. And so one of the hacks that I found about 5 years ago was individual eyelash extensions. I hate putting on makeup. I'm not a makeup person. And so I found that doing that with a little bit of lipstick gave you a totally pulled together look, and it saved me a ton of time. And so for 3 years, I went back and forth to the salon every 2 to 3 weeks to get my eyelashes touched up. Well, when I decided to start iEmergency MD in 2017, as I was working full time, I was starting a company, and guess what? There were not a lot of hours in the day for me to be mommy, wife, CEO, and doctor. So something had to go, and unfortunately, it was my poor eyelashes and my eyelash appointments that had to go. Once I let my lashes go, I really realized how much of a difference I felt like they made just in my confidence, how I carried myself. And so I started to look for other alternatives, and I wanted something that was healthier. I didn't want to use glue, because one of the things that I noticed when I stopped getting lash extensions was how thin my lashes were, how frail they were, how short they were. And I knew that that was done from all those years of using adhesive. So started to do some research, discovered magnetic lashes, and never looked back, and loved them so much. Had some things that I would fix with them, just based on my own experience, my clinical experience, and my experience as an eye person. And so decided, well, I would do this. I would do this to it, and it should have this. And one day I just said, well, you know what? Well, why don't I just make it and give it all those things? So it's just a better experience for other ladies like me who may not have the time to have those appointments every 2 to 3 weeks. So it really was solving my own need, and realizing that that need also was one that was shared with many other women in the same boat as me.
Yeah, and I love what you're doing when you're donating your time to patients who have outpatient or chemotherapy, yes, and you're offering them this service.
Through my company, iEmergency MD, we oftentimes have the privilege to go and do screenings. We did one with your alumni chapter. We have the privilege of doing that a lot. And so we're able to donate our time and the equipment by the influx of funds that we get from that kind of co-ministry. I am an eye surgeon at heart. And so I love doing the lashes, but in doing the lashes, I have to spread my passion for vision and for healthy eyes, because so much of the blindness that we see is preventable. No one should lose their sight from a preventable cause. If there is a way to stop that, then I feel like we as a medical system and as providers need to be the ones to figure out how to do that. So that's just my small part.
Oh, yes, and it's a very honorable and respectful career, and I value your contribution, and thank you so much for donating your time to coming out and supporting our health fair that day. That was wonderful.
It was wonderful.
And I really
I had a
appreciate
ball.
it. Truly appreciate it. How long does these magnetic eyelashes last? Like, do you have to go back every 2 weeks or a week or?
So you don't have to go anywhere, and that's the beauty of it. You can do these right in your home. The lashes last up to 45 wears for our well-to-do line, for our mink lashes. We have a line that is premiering very soon, that is a non-mink lash that gets fewer uses, but is also at a cheaper price point. And so we think of the lashes as more of a value than something that's really inexpensive. If you are a lash person, then you know if you go to Sally's or if you go to CVS and pick up lashes, you might spend $5 to $8 for a pack of lashes, but you're only going to get maybe about four uses pushing it once you apply the adhesive to the lash band, because that adhesive sticks. And you get the residue of the adhesive. With our lashes, there is no adhesive. The lashes have small magnets on them that are attracted to tiny iron oxide particles in the liner. So you basically apply eyeliner like you would any other liner, and then the lash is attracted to that. Once you are ready to take them off, you just pull the magnet away and break the attraction, clean your magnets off, take off your liner with makeup remover, and you're ready for your next wear. If you do that, you keep the magnets clean, you keep the lashes in their case and avoid getting them wet, don't shower in them, don't swim in them, then you can get 45 uses out of your lashes. It amounts basically to less than $1 per use. And it's so true, and most of us don't look at it this way or think of it this way. All of us value our eyesight. I think if you ask anyone out of your 5 senses, if you had to lose one, which one could you absolutely not part with? For that question, most people are going to answer their vision. They'd say, I can go without hearing probably. If I can't smell, if I can't taste, I can make it, but I can't be self-sufficient if I lose my vision. Although we value our vision, we don't prioritize it. Because if I just went, sit on the street and asked 10 random people, when is the last time you had an eye exam? I guarantee you at least 7 to 8 out of 10 either can't remember or it's been more than 4 or 5 years. So for something that we value so highly and something that gives us the ability to function on a daily basis and to see our family smiles and to see our children grow up, we just don't give it the priority that it deserves.
That is so true. That is so true. I'll share with you an eye injury that I had. This happened probably I want to say early 2000. Mm-hmm. I went to get my eyebrows waxed, mm-hmm. and at the time, threading wasn't an option. Like today, I get my eyebrows threaded because I prefer that method. I think it's cleaner. You don't have to worry about the hot wax, and I'm more self-conscious about it because of the eye injury I had with the hot wax. What occurred is that the wax was just too hot, and she did the waxing, and it caused first-degree, second-degree burns to my eye. And at the time it happened, I saw that it was kind of red. I started putting a little bit of antibiotic on it, Neosporin, and it just got worse and worse and worse. At the end of the day, I was diagnosed with orbital cellulitis within less than a week of that whole ordeal. Wow. And I did not realize how serious orbital cellulitis was until they admitted me into the hospital and told me I can't go anywhere. And I was just, connected to an IV. They were pumping me with antibiotics. I had to be in the hospital for 2 to 3 days. It was a long minute. At the time, it was ignorance because I just didn't know the severity of it.
Right.
They gave me a couple of shots on top of that. And at the end of the day, my eyesight is fine. I didn't lose my eyesight. Mm. But they were telling me worst case scenarios of permanent eye damage, blindness. They said something with my brain too. I can't recollect. But can you talk a little bit about orbital cellulitis?
Absolutely. And the first concern I had, because losing vision is not the end of the world. It's not a good thing, but it's not the end of the world. But orbital cellulitis can get to your brain, can spread to your brain and cause loss of life. And so we always consider the possible loss of life even as the most serious thing. And so that was the first thing that concerned me when you said that. So orbital cellulitis is an infection that has gone beyond just the skin or the eyelid and gone deeper into the socket of the eye. And so our eye sits in a cup-shaped socket, and that's what supports it. And so if you get a deep enough cut or a burn, as in your case, it takes away that first line of defense, which is our skin. And so bacteria are then able to get beyond that. Because the skin of the eye is so thin, and if you touch, you can feel the bones just underneath the skin. Bacteria don't have far to go to travel into that socket where the eye sits. Just on the other side of that socket, on the top side, is your brain. On the bottom side is your sinuses. And so a sinus infection can even spread into the eye socket, which is why we have to take those things seriously. So orbital cellulitis is harder to treat because once it goes beyond the skin, it's harder to get the medicine back to that area of infection to kill the bacteria, which is why you had to be admitted to get IV antibiotics, because at that point, just taking a pill is not enough to get rid of that infection. And the threat of spread either to a point of loss of vision or to the brain, which can create like a meningitis type situation, is real. And we take it very seriously.
So do you think any ramifications of the orbital cellulitis can contribute to memory loss?
I do not, especially if it was contained in the orbit. So if it actually spread to your brain, you can have far-reaching complications, even with any kind of traumatic or infectious brain process. But if it was contained within the orbit and never shown to be involving your brain, the loss of memory loss or any other neurologic type symptom is small.
Okay, good to know. I rest assured. But yeah, that at the time, like I said, it was shocking.
You know, you mentioned just waxing your brows, but I see injuries like this all the time. What I particularly see this time of year is people, men who and women who've been in the yard with weed eaters or mowers and things like that, not wearing any eye protection. It takes a split second for that piece of equipment to throw up a rock, hit you in the eye if you don't have on any eye protection. I have seen many people sustain serious eye injuries up to and including removal of the eye because we could not fix it from something like that. And so it only takes a moment for a devastating thing to happen that can change your life forever. So that's why I always tell people, you have to be careful. You have to use eye protection. You have to use good judgment when you're choosing who to go to and who not to go to. And you just need to know your skin and your body. When you mention waxing, I can't get waxed because every time, even if the wax is lukewarm, it pulls my skin off. Every time I end up with a big red abrasion or a scrape there. So I know that about myself. And if I can't get my brows waxed or if I can't get them tweezed, guess what? I have bushy brows because it's not worth it. So it's knowing those things and being careful with who you let provide services to you.
Absolutely. So where can we get our book and find out how to contact you?
All right. So if you would like a copy of my book, The Handbook of Eye Emergencies, then I will send the book to you free of charge. I sell it on Amazon for $19.99. I will send it to you free of charge. The only thing you will have to pay is shipping. That's it. You can go to www.tinyurl.com/Dr. That is Dr. Anika, Anika, handbook, HANDBOOK. And I have some really good information in here. I've gotten great feedback and reviews from it. I definitely love the fact that you have pictures that will help you determine the severity of what might be going on with you.
Well, thank you for being on the show, Dr. Anika, and thank you for blessing the audience with a free copy of your book. That is excellent. And keep in mind to my viewers that if you are dealing with any eye issues or concerns, please do not hesitate to contact Dr. Anika, and she'll be more than happy to address each and every one of them. So thank you again. And to my viewers, let me leave you with this quote that Dr. Anika also said from William Shakespeare's. Only in the eyes of love can you find an infinity. God loves you, and thank you for watching.